I would like to share with you a very interesting case which explains this deeper study of biopsychosocial model. Young man of 31-year-old was presented to me with complaint of acute breakdown, mental breakdown. He had developed delusions that FBI is after him. He had a delusion that people are against him. He is surrounded by various enemies. The interesting aspect of the case was not just what delusion he had. The interesting aspect of story is that when I asked in detail to parents that how he ended up into this state. The prima facie story came up that this patient went to USA for further study, master's study. He had a very little financial resources, but he gathered some money working in India, and then parents supported, took bank loan. So when he went to USA, he had a lot of strain of working and studying both. So he used to do day and night work. So in afternoon, evening he used to work. Again at night he used to study, and he wanted to finish entire study of 1.5 years into 1 year. Typical Indian struggle. He was really doing well. But after 9 months, suddenly he started developing some symptoms. He started closing all his curtains. He started telling his friends that FBI is after him. And his mental state started deteriorating. Friends helped him, counselor in college helped him to some extent, but this has not gone. So then college decides to send him back to India because he had 1 or 2 episodes of violent outburst also. At airport he misses flight, and I am not surprised why he will miss flight, because his attention, his ability to self-care has reduced so much. On top of it, he was moving here and there searching for his flight with lot of bizarre behavior. So 2 guards came to him and tried to ask him question, and he felt that this FBI, as he predicted, is after him. And then he became violent, he was taken to custody, and his delusion became more and more confirmed phenomena. That's what he goes through. Ultimately, parent had to go down to USA to bring him back to India. He was brought here, he was started with immediately modern medicine, but as usual his symptoms were partially better, and he started showing lot of reactions to medicine. So they, in past, lot of family members used to take homeopathy, so they requested me whether I can do something. Now friends, this is social aspect, financial aspect, cultural aspect. All these aspect produces lot of issues with mental health in this case. But more important is go into detail of this case. And when I went into detail, I realized that he developed tuberculosis somewhere at the age of 28, 29. And he was treated heavily with medicine. After that treatment was over, when he went for the study, this breakdown took place. Now, if you try to see from homeopathic perspective, this history is important. The past history of treatment of tuberculosis is critically important for us, because if he's been treated with certain type of medication, the expressions of tuberculosis is gone, but it has turned into a miasmatic phenomena within him. Now the entire expression has come at the mental level rather than expression at the body level. So the resources of the body are getting depleted, and the focus is shifting from body to mind. And this shift is critically important to study for homeopath. For homeopath, every small such history going backward is critically important. And n number of cases I have seen that past history of tuberculosis, past history of treatment of thyroid, specifically hyperthyroid, past history of treatment of various strong infective illnesses, all has some or the other connections. Rarely you see, but I have seen cases of even typhoid, post-typhoid treatment. People have come with typhoid psychosis, which was very common in past. So same way, if you try to see in this case, patients, this history was critically important. And then you go back to early childhood where there was a lot of poverty and lot of struggle which he has seen. And he had lot of heavy load of ambition inside him. He wanted to prove himself. He wanted to prove that he can do something in his life, and this aspect of him has made him to struggle more than usual. And there is some point where system goes into breakdown. So this breakdown, which is right now an acute breakdown, but the original history starts from his childhood, his build-up of ambitions, which was exaggerated state, his further traveling into infection, which was treated aggressively, and then you see now breakdown coming up at the mental level. So now when you study this case evolutionary, that the load of tubercular miasm was so heavily built within him. Unless and until you address this, you will not be able to cure. And friends, you open up aphorism, where Hahnemann talks about in 215 aphorism that most of the psychiatric illnesses are corporeal in origin. In college days when I used to study, I used to surprise, what is this corporeal in origin? Now I realize that most of the illnesses start somewhere at the deep rooted in the body, and if it is not handled adequately well, it turns into psychiatric illnesses. Friends, why I am quoting this case is very, very important. Can homeopath prevent this entire sequence? If that child comes to you with over-ambition, if you would have treated with remedy at that time, might be Nux vomica or Veratrum alb or Lycopodium, would have prevented the whole flow of this man's going into this breakdown even at the tuberculosis level. If post-tuberculosis, even if you have given modern medicine, treated properly with homeopathy, would have prevented this entire psychiatric breakdown. So when we talk of mental health, we have to connect to the entire gamut of evolution of mental health. It happens, it starts in a very micro level, at a very invisible level, and then furthermore it proceeds. So homeopathy has a tremendous role in preventing the whole aspect of psychiatry. So if we take cases, whatever cases you are taking right now, even of childhood, and you are handling that case as a child, you don't know you have done massive service to society by preventing this child slipping into a psychiatric illness in future. Same way, another aphorism, which another insight into Hahnemann's these guidelines. Like this boy was helped actively with Alzheimer's in his acute state, where he had this extreme delusion that he is surrounded by enemy, people are there to poison him. So all that was helped by Alzheimer's, and followed by his main remedy, which I studied and was found out to be Ferrum metallicum, and he was better with Ferrum met later on. And you open up aphorism, I think 221 to 23, he talks about that most of such acute illnesses needs to be treated with remedy like stramonium, belladonna and other thing, and follow it with antisoric remedy. So if you unfold Hahnemann's various aphorisms, it's very, very interesting to see that he has gone into the depth of his practice, seeing patient with that intensity. And that intensity of observation has led him to write these aphorisms before even modern psychiatry was evolved. So it will be very interesting. I would like to see you in seminar, where I am going to share number of such interesting cases from our IPD experiences at Palghar. We are blessed that we have a casualty, we have an entire IPD team, we have MD students who are helping in coordination. My entire staff is there, Dr. Sunita, Dr. Rajesh, Dr. Abhishek, all of them are working together with me, and we are trying to help patient in even bizarre states, acute state, and some of these cases I am going to share in this CME. Thank you very much.